Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin momentarily. We will take questions that have been submitted by members of the media after Dr. Garza makes brief remarks. I'll now turn it over to Dr. Alex Garza.
Okay, thank you and welcome everyone. Thanks again for joining us. So we talk a lot about numbers in this room with every briefing, and sometimes it can be hard to remember that behind every number is a person. Every number we discuss is a person who has friends and family who are hoping and praying that they will get better and come home from the hospital. And as we've talked about, that is really what drives our healthcare teams in our systems. They work day and night to help COVID patients get better and to get back on with their lives. And oftentimes that works. Now, we've been able to see more than 11,000 people go home since the whole pandemic started. But as healthcare professionals, we have also learned that we can never underestimate the deadly ability of this virus as well. It can and it does kill people, and we're starting to see a disturbing trend line in that area. When we began seeing the current surge back in October, each day we saw around 7 COVID patients in our systems that would lose their lives to this virus. 7 people every day was too many deaths. But in just a couple of months, that number has effectively tripled. Right now, every day, we're seeing the virus kill approximately 20 patients who have been hospitalized. That is 20 people a day who won't be going back home to their loved ones. Now, that surge in deaths is completely consistent with the increase in the number of patients hospitalized. Since October, we have effectively tripled the number of patients. So the increase in the number of deaths isn't too unexpected, but it's troubling nonetheless. So as I spoke with our teams at DePaul Hospital today, they were telling me that sometimes they feel hopeless when they see a patient take a turn for the worse, because they've seen it so many times before that the patient will not be discharged from the hospital. And I spoke with our friends in pastoral care who told me it's taxing on them because of all the conversations they have been having with families in discussing end-of-life care over and over again. The number of deaths is doing the same thing in our community, including patients who are not in the hospital. When you look at the number of COVID patients in the community, the data from Illinois and Missouri provide, it shows deaths have increased significantly as the number of cases has increased as well. So, if anyone tells you that the virus is not that deadly, or that everyone who gets it gets over with, they're wrong. The virus is fatal to a certain percentage of the patients, and when more people get sick with COVID, more people are going to die. That's the deadly math we are seeing right now, and despite the incredible, heroic work from our teams, the best things that we can do to stop the virus from spreading and getting people sick are those things that we've advocated for months. And that is wearing a mask, social distancing, washing our hands, not gathering. And that's why the CDC issued guidance late on Friday in their most comprehensive list yet, talking about universal use of face masks. Universal meaning everyone at every time when you're outside of your house. Postponing travel, physical distancing, avoiding non-essential indoor spaces, and other things. This is the best way to keep the virus spread down and to keep people alive. The truth is our hospitals will do everything possible to keep patients from dying, not just all COVID patients, but all patients. But preventing those deaths also depends on everyone outside of the hospital. When more people wear masks, stay at home, and keep at least 6 feet of distance, the virus starts to lose ground. And that's when we start to save lives. Now, many states have in place proven measures that we know slow down the spread. We know that mask mandates increase the number of people wearing masks. We know safer at home policies help keep the virus in check. But we are still fighting this battle without all the weapons and tools that we need. Now, I hope that changes, but until it does, you are our best hope that we have to slow the virus and to buy the time that we need. Again, this is a time of war. Now let's take a look at our numbers and see where we stand today. So we'll start with a graph highlighting our regional hospital admissions. And we saw a significant downtick in our reported numbers today. But remember, these numbers are delayed by 2 days. The daily admissions number that we're reporting today is 81. Our rolling 7-day average continues to be very high at 113. And as we've said before, we don't put a ton of stock into these day-to-day fluctuations, and we look at the trends. Moving on to our hospitalizations. So as we've seen, though, despite that lower than expected admissions data, our census data has moved up significantly. Today we're reporting 894 hospitalizations with confirmed COVID positive patients. And the moving average is now at 903. Taking a deeper dive into our numbers, this slide represents again all of our COVID positive patients and doesn't include those that are suspected of having COVID. So again, we had 894 patients in our hospitals today that were confirmed COVID positive. We have 187 COVID patients in our intensive care units, which is down slightly from yesterday at 194. And we have 117 confirmed COVID patients on ventilators, which is up from 115 yesterday. So now let's take a look at our hospitalization numbers for suspected COVID patients. Today we're reporting 80 hospitalizations of suspected COVID patients. We have 15 suspected COVID patients in our intensive care unit, and we have 7 suspected COVID patients on ventilators today. Taking a look now at our discharges. So again, we have a cumulative 11,668 patients that have been discharged from task force hospitals. Yesterday we reported 64 additional discharges from our hospitals. And again, another shout out to our healthcare teams and everybody that supports them to get these patients well enough to go home. So one thing that we did want to share some data with, and as I mentioned when I opened today, was looking at our death data. And so we began taking a look at this, trending it over time. And as you can see from this chart, we've seen a dramatic uptick in deaths, which really started during around that second week of November, which coincides with the uptick in hospitalizations. Now, as we've said before, whenever you see this increase in the number of cases, you're going to see the increase in the number of hospitalizations, and then you're going to see the increase in the number of deaths. Now, deaths will always be a lagging metric because it will come at the end of a sometimes prolonged stay in our hospitals. And so to highlight this, we've combined all 3 of our graphs here to show you the uptick in new admissions, the uptick in hospitalizations, and then the uptick in deaths. And this is just a sad reality of what happens when COVID is spread without anything in check. On Mondays, we typically update everybody on the model as well and show everybody where we are. So this is an updated model from last Wednesday, and it shows a slowing of the growth. And so if you think back to where we were around 3 weeks ago, you'll remember that we were on an exponential growth phase. And we seem to have slowed down a bit from that, although we continue to increase. And so although the slope has decreased, it still is on an upward trend. And that is dependent upon how much transmission is occurring in the community. So although it's better news, we're still seeing an increase in the number of cases. And adding on to that we're already starting at a significantly increased number of cases. So it doesn't give you, a whole lot of feeling of comfort. So then we take a look at how do we model this out going forward, and we know that there's a couple of different ways that we could go with this, and it really depends upon how much transmission is occurring out in the community. And again, this doesn't factor in what we think we're going to see from Thanksgiving, where we know some people have gotten together in groups or traveled around the country. So our worst case scenario, as you can see in the red line here, it corresponds with the reproductive factor down on the bottom of around a 1.5. And if that occurs, then we believe that we'll go past our capacity in about a week and a half. If we continue on our current trend, then we'll get close to our capacity around the end of the year. Of course, if we interrupt transmission and keep it suppressed, then we'll start curving down. But we're still waiting to see what happens because of Thanksgiving. These are just the larger pictures of our inpatient census, and so as I said, we're close to 900 right now. These were dated back to Wednesday of last week. And so as I said earlier today, we're at 896, so still close to that 900 number. And then our ICU status as well continues to climb. And as you can see with that slope, the projected model from what we're seeing out in the community will continue to climb as well. And I can just tell you anecdotally from visiting DePaul today that they were creating space by doubling patients up in our intensive care unit, and we're trying to shuffle beds around so that they could start bringing in more patients into the intensive care unit. And in speaking with our other hospital partners, this seemed to be a common story. Other things to share with you, of course, is our Epi Curves. We did see that dip from last week, earlier this week. However, I know from talking with some of our public health partners, we're beginning to see an uptick in those cases as well. And so we're expecting that to turn upwards once we get through this early part of this week. That phenomena was seen throughout the different counties in our metropolitan area as well. You can see from all of these curves there was a downtick in cases. We spoke about this before previously, that this might just be a reporting delay, or it might just be because people weren't getting tested over the holidays with testing centers shut down. And so we think within the next week we'll be able to have a better idea on what this actually means for the community. And then looking at the cases across the state, again, a very familiar scenario with those cases ticking down over the earlier part of this week. But again, we'll see what happens in the latter part of this week and going into next week before we feel comfortable. Our reproductive number, which is dependent upon some of those cases, has been ticking down, and so that's good news. But again, we're reserving any judgment about what does this really mean for the community. Right now we're sitting a tad bit below 1, which is good, but we'll see what the rest of this week is going to bring to us. Because of those lower numbers this week, most of the counties outlined here are in blue, but again, we have a high number of cases still. We just have less number of cases from the preceding week than we had the week before. And so, again, we'll see if this holds over time. Believe me, we want it to hold over time. But we're trying to be very cautious. And then a couple of areas to highlight, 2 over in the Illinois side in Brighton and Greenville, and then 1 zip code in the city of St. Louis, where we saw an increase in the number of cases week over week. So in conclusion, there's still a lot of cases that are popping up in our community. As you saw from our census data in our hospitals, we're again closing in on that 900 number. The 81 admissions, although we will take it, we want to make sure that that we continue on that, and the only way to do that is to decrease the number of cases. So sadly, because this virus is infecting and killing more patients than ever, it's too late for some of these patients. However, we can decide what we want to do going forward by helping to prevent spread and save lives in the future. So that concludes my remarks, and now we'll take some questions from the media.
In the past week, and as you just showed, we've seen new cases and total hospitalizations start to plateau and even decline a little in Missouri and Illinois. Why might we be seeing these trends, and have we yet to see the impact from Thanksgiving?
Yeah, so as I mentioned in our remarks, it's hard to interpret what that signal means. It could be because testing sites were slow over the Thanksgiving holiday and that weekend. There could be a delay in reporting from the labs, although I'm not sure about that. So there could be any number of things. Or it could be, yes, we are actually seeing an interruption in transmission. So all three of those are possible. Now, I know in talking with some of the health departments over the last couple of days that they have seen cases rebound back up to that pre-holiday number. And so, again, that gives me a little bit of caution that we're actually seeing a sustained decrease in transmission. Some of the admission numbers have been coming down a little bit, but then they'll pop right back up. But in any case, anytime we're hovering around that 100 admissions a day mark over a 7-day rolling average, I can't find really much good news in that. And so, we're going to keep an eye on it. We are hoping that it's a decrease in cases, but most of the signal that we're seeing now tells us that that's probably not the case.
On Friday, the CDC issued guidance stating that indoor dining is a high-risk scenario. Also on Friday, you presented new hospital admission rates, which showed that the city of St. Louis's rate was higher than St. Louis County. Could this be attributed to the fact that the city of St. Louis has continued to allow indoor dining, where the county is following a safer at home model and is prohibiting indoor dining?
Well, it's hard to attribute any direct correlation to any of those. So I'll put it to you this way. Anytime where you have people coming together in a confined space where they're not wearing masks for a significant portion of that time, which we know does occur in dining facilities, for obvious reasons, that's a high-risk environment. So whether you could say all of that is contributed to by the restaurants in St. Louis City versus St. Louis County, I don't know if you could go that far. It certainly does contribute to it, but there are most likely other reasons as well. But certainly it contributes some, we just don't know how much.
On Friday, you also said that there were 2 hospital beds available in the entire St. Louis region. What does this mean for area residents when they assess the risks they take every day, even things that seem to be low risk?
Yeah, I believe I was, referring to our ICU capacity within the SSM healthcare system, so I apologize if I was misleading in that statement. So, what that means is, regardless of if you have COVID or not, when we're stretched to capacity, it puts a strain on taking care of all of our patients. So things like heart attacks and strokes and motor vehicle crashes and all of those things that require a higher level of care, it puts a strain on our systems. Now, we'll always take care of those patients, but it certainly does increase the complexity of having to take care of those patients. It makes it certainly challenging for our healthcare system, and when we know, and I've said this before, whenever we're stretched to capacity, we're not. It makes it difficult to deliver your best care because you're trying to divide your best care amongst multiple different patients, instead of being at a rate or in a position where you can focus more on the patients that you have at hand. So it certainly makes it difficult for the healthcare systems.
I've heard a lot of people talk about the potential for a holiday surge in admissions. Is that something that local hospitals are ready for? And how does capacity now compare with the normal season?
Yeah, so I will tell you that our capacity now is higher than it would be in a quote-unquote normal season. So that is true. As far as a holiday surge, if you're talking about a holiday surge from COVID, that's what we're still waiting to see, is what happens with Thanksgiving, what's going to happen with Christmas, Hanukkah, all of the other holidays that occur. So we're not sure what's going to occur from that. If you're talking about holiday surges from non-COVID patients that we would have in a normal year, I'd have to take a look at some of those census numbers and get back to you on that to see if there's an additional for that. Now, I will say that this year has thrown a lot of traditional census data sort of out the window. And by that, I mean, we weren't seeing as many cardiac patients as we were in previous years, or other types of patients that we'd been seeing in previous years. And we do believe that that's because people have been hesitant to come to the hospital because of the high volume of COVID patients that we're seeing. And so it makes it difficult then to compare previous census numbers to what we're seeing this year. This year has been extremely different in many different ways, and that's one of them.
The White House released a COVID report last week essentially saying that Missouri needs to do more, much like the states around us. What's your impression of this report on the state of the virus in Missouri?
Well, I agree with those points. We do need to be doing more, and I don't think we've been, silent in addressing those. We've asked for a state mandate and a state safer-at-home policy. So we agree with all those points from the White House.
Are you or others with the task force hospitals in contact with the governor's office? And if so, how frequently and what do you need from his office?
Well, I'll refer to my previous answer on what we need from the office. So the state has, though, signed a contract with Vizient, as we've talked about before, to help provide staff. So we have said that we need staff as well in order to increase capacity at our hospitals, or really just to give a little bit of breathing room to our healthcare systems. Yes, there are members of the task force that do meet with the governor on a regular basis, and they've been very clear on what our position has been.
That concludes the list of questions received prior to today's briefing. Thanks for watching.